Welcome, everybody, to our May Global Nursing Climate and Health Committee group call. I am so excited for today's presentation. Um, please join us in welcoming my colleague and dear friend, Raluca Radu, a nurse leader specializing in planetary health and climate resilient health systems. Oh, letting another person in. Her work spans clinical practice, academia, and global health, including coordinating Providence Healthcare's first organizational strategy on planetary health, as well as leading climate and health education at the UBC School of Nursing and at Doctors Without Borders. Medicines San Frontieres. Deeply engaged in national and international collaborations, Raluca drives equity-centered, scalable solutions for sustainable health. She is passionate about equipping health systems, communities, and individuals to take meaningful action to advance planetary health through climate adaptation, mitigation, and long-term resilience. And today, she will be sharing with us an adaptation of her presentation, A Nursing Journey Towards Planetary Health, that she recently gave during during National Nurses Week on planetary health education and her experiences in the BC health systems, including reflections on her journey in this space and how it has personally been transforming over the last 7 years. Welcome, Raluca, and you can go ahead and take it away.
Thank you so much, Millie. I'm just gonna take one quick moment and hopefully just one sec. Play from start. Okay, I hope that's visible on your end. And I know my chat and my view of you has disappeared. So is this good for you?
Yes, everything is
Okay.
perfect.
Perfect. Thank you so much. Well, first of all, I just want to say I really appreciate the opportunity to join you all to share some of my journey. Unfortunately, this time around, unlike last week when I had to give this presentation, I actually had to do it in a lightning speed of 10 minutes. And I honestly flew through the slides without, I feel like I haven't really quite had the chance to dive into what I really wanted to share. So it's actually nice because this is going to be a slower pace for me. And hopefully it will. I'm hoping that it leaves out plenty of room more for conversation. So really, so that it's more like an formal slash more informal approach to how I will share my journey. So before I dive in, and I do have some notes to kind of keep me on track, I think my initial goal, and it stands still, is that I really hope that this presentation can kind of continue to inspire you to visualize that planetary health education. And I would add, while the purpose of this was on education, I have done a lot more beyond education. But what I think my takeaway is that planetary health related work can look very different in unique contexts. And I think that the beauty that we have learned collectively by being nurses is that our profession is versatile enough that allows us to kind of mold our critical thinking and skills to the context where we are. And that's kind of the same takeaway message I'm hoping you'll come with from this presentation. So before diving into the actual context, I do want to take a moment to situate myself and on the lands where I've really been very privileged to live, work, and play since my parents and I immigrated here in Vancouver, Canada, back in 2002, originally from Romania. And for me, that is on the unceded, ancestral, and the traditional territories of the Coast Salish peoples. And that for here includes territories of the Musqueam, the Squamish, and Tsleil-Waututh nations. And I share this image from a place called Ucluelet. The spelling is quite different. If you read it, you'll think it sounds like ukulele, but it's not. And it's on Vancouver Island. It is one of my favorite places in the world to visit because it really brings you back into that raw, deep connection to land through not only the beautiful exposure to that just rugged Pacific Northwest traditional landscape that you would anticipate when you're on the West Coast, but also just a reminder of what came before and what will always be a constant in the universe and on this planet, as Mother Earth really is alive in all its glory in the space. And I will say that is really in huge gratitude to the indigenous peoples who have inhabited not only like where I'm situated, but Vancouver Island. I feel especially, I feel there's so many signs that nature is so deeply protected. And for me, that is a reminder to kind of constantly engage in a culture of gratitude, which I've learned from some of my readings. Actually, a book I finished recently, Braiding Sweetgrass. This idea of engaging in cultures of gratitude, which is pretty much the same as engaging with cultures of reciprocity, and what reciprocity actually means when we think about our relationship with the earth and what it means to actually give back to Mother Earth the same way that she gifts us the air, the water, and so forth. So I just wanted to share that piece with you. Um, so one thing I did in last week's presentation, because my hope was that in that audience there would be a lot of new grad nurses as well, but also more seasoned nurses, is kind of coming back to our roots. Oftentimes, I think we might shy away from revisiting definitions because I do think, I mean, I'm a person who paints outside the box in the sense that I am a disruptor. I like to always look at the systems, but I also think it's important to come back to the roots, the why, the calling of your profession, which ultimately, as nursing, I would say it does shape who you are, not just professionally, but also outside of your work. I feel like a nurse is a nurse outside of a 9 to 5 or a 7 to 7 schedule. And so I thought it was really important to remind ourselves that now, you know, the International Council of Nurses has fortunately redefined the contemporary definition of the contemporary modern nurse, just to really consider and center all the issues that are currently at play globally. And I highlighted in green, you know, the fact that now the nursing profession, and it's always been dedicated to upholding everyone's right to enjoying the highest attainable standard of health. But one important addition to this is that doing so also by making sure that we are advocating for people's equitable access to health and healthcare and safe, sustainable environments. And I think we've always done this. It didn't have to be defined, but now that it is, I feel like there's that wide consensus that we see the importance of nurses at these critical intersections, and really validating that the work matters and is important. So I think it's important to come back to this if we ever come across questioning the why. So I'm going to walk you through a bit of my journey, and I'm going to start with where my own roots in the space of climate change and health, where it all began for me. And this, I would say, this dated to 20. I know that the document says May 2019, but my work in the climate and health space started in about 2018 when I was in the middle of doing my master's at the UBC School of Nursing in Vancouver, and I kind of came across a series of webinars on just the general climate change and health impact, something that I had known about climate change, and I knew that, you know, I was aware of wildfires and impacts of wildfires because here in Vancouver, we were often affected by very poor air quality when there were wildfires in Washington State or out in the interior of BC. But I never knew the extent to which climate change in general can affect health, well-being, psychologically, physically. And as a nurse, I felt compelled because it wasn't something that we ever talked about in the nursing curriculum. Like we would talk about, you know, infectious diseases. We would talk about just general environmental sort of infection prevention control, but there was never ever a mention about environmental stresses on health and well-being, at least in the curriculum that I studied in when I did my bachelor's, and same thing in my master's. And so I just felt like this was the right time as a student to focus my master's project on diving deeper into this matter of climate change impacts. And so the first document that you see here is actually as part of a practicum with the Association of Nurses and Nurse Practitioners of British Columbia. I essentially said to them, like, your last policy related document was dated, I think, like 2008. And I asked for the permission to kind of, you know, take a stab at it and try to actually revamp it so that it was more timely, and in line with the issues that were at that time very, very apparent. And we know actually there's nothing new in there that hasn't happened or isn't forecasted for the future. And so this was a product of that practicum that became an official policy paper, which for me at the time as a student with no background in policy and like writing these kind of documents was quite a moving experience to be a part of. And that kind of pretty much catapulted the rest of the work that I've started. After that, I finished my my MSN project. Essentially, I developed a very basic foundational tool that would essentially cover the essential things that I thought at the time nurses should know about when it came to understanding climate change and what that meant in nursing practice. At the time, I hadn't come across anything very specific. There was a lot of literature out there. There was a lot of different resources, but I kind of wanted to do something a bit more consolidated. And from that, essentially, and I would caution that this, as you can note, that was January 2020. That was pre-pandemic. I would say sometime in March, well, when the pandemic came, I had a 3-month contract working with 811, which is essentially the telehealth 24/7 hour nurse line, where I had the chance to respond to the initial first wave of COVID-19 pandemic. And from that role, I moved into my teaching role at the UBC School of Nursing, where I essentially, among additional nursing courses, I was also handed the Nursing 290 Health Impacts of Climate Change course, which at the time I had also been a teaching assistant in when I had worked as when I was doing my TAing during my master's. But then when I had this course handed to me as a lecturer, my biggest task during the pandemic, when all the classes were virtual, was to take it from an asynchronous course to a synchronous course. And that's when the real test came to me, because I really just had to work off the curriculum that existed, but build it so that it was as interactive as possible in a virtual environment. And so I took a very experiential approach to the class, and that was very, very enriching for my students. It led me to the opportunity to develop with my colleague Aubrey McCaddy a case study that is available. Happy to share the link afterwards. I wanted it to be an op-ed resource. And I wanted to help students see that, when we talk about climate change, it's not just what happens overseas in the South Pacific, in Africa. Like, I wanted them to see and understand their roles as future stewards of protecting the land as well, at the different micro, meso, macro levels. And with that work, it did get a lot of exposure. I ended up starting to do a lot of interviews with media and kind of being called upon as a nurse who started speaking at a very high level in terms of presence in the media, which typically is done a lot more often by my physician colleagues and friends. And that to me made me feel proud, because I wanted people to see the nurse as a contemporary nurse, beyond the bedside, beyond those parameters that oftentimes we so rigidly are assigned in. Once I had the opportunity to kind of work in academia, while I was working at UBC, the opportunity came to apply for a role with Doctors Without Borders. I will have to be transparent and say I did not expect to get a call for an interview. I mean, I knew applying to Doctors Without Borders was going to be like a long shot, but I always say, you know what, you never know until you actually give it a shot. And long and behold, I went through a series of interviews. I had a test to like develop an education, a presentation. So it was a pretty rigorous process, but it was great because it was a nice sort of preface as to what was to follow. And I mean, these are just 2023 personal highlights. I was there for about a year and a half. And so essentially I was hired to work with the mitigation team as their international climate and health educator, to essentially build the business case for all operations across different teams across MSF, of why decarbonizing healthcare systems, of why decarbonizing operations in the field was important, for essentially for not only reducing costs, but also helping people understand the role of why mitigation is essential, even in that humanitarian context. So in that context, I had a chance to engage. Albeit most of my work was virtual. I actually, the year when I left, I actually had some issues with visa, but I was supposed to go to Bangladesh. to do a series of workshops with staff in the field. But unfortunately, with MSF, there's always priorities given. If there's conflicts or last minute crises arising, they will essentially put on hold any visits that are not deemed essential. And in this case, at that specific time, for many reasons, my visit was not essential. So unfortunately, I did not get the chance to go to the field. However, I did get the chance to build capacity to people by engaging with them across different continents and also working with my colleagues across Europe as well in co-authoring the 2023 Lancet Countdown Policy Brief and serving as a panelist wherever I could to represent MSF. And during my time there, I also had the chance to collate sort of an environmental resources toolkit that was also kind of this is only internal to MSF, but it was the purpose of it was to make sure I consolidated a lot of the humanitarian specific educational resources that addressed climate change and health and responses and how those applied in the field. And I would say that honestly, my experience with MSF was life-changing. It was an opportunity for me to take a step back from the academic side. I really had to unlearn a lot and relearn or learn new things, new ways of doing things, and really honing in on those ideas of like what it means to be coming from a place of privilege when it comes to building capacity and really understanding the role that we have to take a step back and design education that is tailored for audiences to understand in very foundational elements, sort of basic ways, rather than being too high level theoretical where people can't really relate. And that was something I really needed, and it really shaped me for what was to come next. Um, I loved my role there. I had a very hard time leaving the role. But the reason why I left at the time was because locally, the new role with Providence Healthcare, which also I would say is temporary. So unfortunately, that contract ended just about 2 months ago. So this role that I just finished was a role of 2 years, and I was the organization's first and only planetary health lead. There's similar roles across British Columbia, across the different health authorities, but I was the one nurse in the role across BC, which made it very unique. So when I worked at Providence, essentially, as Mili said in my introduction, I did help the organization essentially build their strategy on planetary health, which was set for, I think we did it from 2024 to 2029. And then in that organizational health strategy, which you can actually access if you look this up, we settled on 3 strategic directions. And primarily the one that I really oversaw the most was to build our capacity. So a lot of testing out models as to how to best educate frontline staff, and essentially try to develop as much capacity as possible in as little time as possible, because frontline staff, as we know, are very, very busy. And so while I was engaging with that, I was also actually a student in the Health Quality BC Quality Academy, where I was learning foundational quality improvement. And in that, I decided that my projects should be focused on building capacity about planetary health. And so this is just a screenshot of, I essentially did 3 cycles of PDSAs with 3 different cohorts of new grad nurses and allied health professionals that were joining the organization for the first time. And basically, like, the takeaway was that, yes, as you could see, like the session, engaging in the session and the workshop of learning about planetary health indeed increased awareness for staff. So it was a very interesting kind of experience to not only engage organizationally in a leadership role, represent the organization across different committees, all while building capacity for others, all while I was also building capacity on quality improvement, and also where planetary health is now seen as embedded within sustainable quality improvement. And I think one of the things that I shared in last week during the Nurses Week is that in the clinical world, I'm going to just populate all 3 images. I think my favorite, and what I think is probably the most efficient way to build capacity that is sustained about climate change, resilience, adaptation, mitigation, whichever kind of domain you associate most with, is actually through community building events that are hosted internally and also cross organizationally and in partnership with both staff and also external stakeholders. I found that every time we organized events, and so this is the last fair that I was able to organize. I was part of organizing two sustainability fairs in my time there. But it really creates a sense of community. It builds camaraderie, and also it helps the staff who come by to learn about food services initiatives, or to learn about active transportation and what's offered by the actual organization, to learn from Indigenous elders who open the ceremonies in a good way, and hear the stories from the lands and what it takes to actually safeguard them, to actually having, I don't know, many of you might know her. This is my friend and physician colleague, Dr. Melissa Lem, and this is the CEO of Providence Healthcare. So we engaged in essentially tree planting events where we also had patients join us. And I couldn't share photos of patients because those are protected. But just to say that when you have people from different levels of leadership, and also both at kind of from the front line, from different disciplines coming together for these events, I do find that community of practice is very sort of solidified, and it strengthens the work that we undertake collectively. So basically, it's really the takeaways that those community building activities have, in my opinion, have and will always contribute to a shared and unified purpose towards achieving planetary health. And I definitely miss a lot of these people because they too are essentially champions of change in their respective ways. So this is kind of like my closing slide, but I think um, coming back to my mantra. So when I first started this work, I remember also watching some presentations from people I really look up to, such as Dr. Courtney Howard, who I think that one of her presentations, I first saw this diagram when I invited her to present to my students when I taught at UBC, and this idea about ceasing to see ourselves as human beings at the top of the pyramids from that ego model, and rather transitioning and being engaging in a journey with ourselves, with our surroundings, to go to the eco, where we really do see ourselves as embedded within the larger ecosystem. But in that journey, I will add, that is very, very important to take any step, whether it's, even if it's engaging in one single activity because that's all your time permits. There's no level of work that you can do that's not going to be significant enough. Every single action has and can create a ripple effect. And so that's why I highlight incremental small steps at different levels can and always make a difference. But that also means that we have a moral obligation, I would add, as nurses, as healthcare professionals, to interchangeably kind of engage with these three different levels. So there's people who might feel more comfortable staying with the micro, and if that's your strength, that's fantastic. I think if you can work on those behaviors, both in your practice and at home, to engage with more sustainable practices. The meso, I think, is very powerful, and that comes back to that community building. I think that if you're able to engage on a green team in the hospital, or to help promote the idea of organizing a sustainability fair, and doing that regularly, so that has sustainment, I think that's a very, very strong one. And I think it's one that's not capitalized enough on. And then the macro level, I think, is probably the one that can be a bit more challenging sometimes, because it does take that additional step to engage in that advocacy. But I don't think it's impossible. I really do believe that when we do both the micro and the meso, it inadvertently sort of contributes to the macro level. And I know that, I know Annie does that excellently. Kane in Canada, the same, and many other organizations. But I would also say, if you're able to do so at the municipal level, I think it's very, very powerful. And I think I had this slide because these are the organizations that I have essentially looked up to and have been engaging with, even from a distance, and making sure I'm always receiving newsletters, but also making sure that their resources were known, especially for last week's audience, when I was asked for a Canadian context. And I think generally speaking, the whole point is that we only have one planet. We already know that. I know I'm preaching to those who are already believers, but I do think that each of us essentially have a part to play in cultivating a healthy world. So with that, I'll stop sharing my screen if I can, and then I would love to engage in conversation. And
Wow.
sorry if I spoke too fast, but yeah.
You were you were more than perfect. Thank you so much. That was a phenomenal presentation. I am happy to open the floor. Yes, yes, we're getting hearts. Well-deserved hearts. Thank you so much. Um, I'm going to open up the floor now to any comments or questions.
So kind.
I think that there's so much um, connection that can be sought after and strengthened between Kane and Annie and our American nurses. And could you talk to maybe a little bit about if you know some of those projects or connection points and what are some aspects? Because we are, this particular committee is the global committee, how we can strengthen those types of connections and projects looking forward?
Yeah, I mean, I think that's a great question. I think trying to sift through my brain right now through the initiatives that are not specifically regional, but there can be and should be shared. Like, for example, I know that there's been a huge push to integrate education, to integrate essentially what I just talked about into nursing curricula. And there's kind of different tiers of work happening in pockets. But I kept wondering about whether, especially since from a geographical perspective as well, like, we are in North America, at least for, if I'm thinking Annie and Kane, although we do have engagement internationally as well, like predominantly from a geographical perspective, I wondered if there's a way to sort of collate our efforts and have that business case stronger on education. Through that approach, like because I'm not like I'm seeing some progress, but I feel like our colleagues in medicine are definitely making more headway. So I think the educational piece for me is always the first priority. So if there's a way for us to collaborate there, that would be an important area. The second one, I know that there is a global book that or textbook that I had the chance to contribute to, and I'm sure, like, because the call went out to a lot of people all around the world, and I think that will, and I know that they're all like Annie and Kane members and people from other parts of the world, and I think that will also kind of provide a platform to kind of showcase how these organizations can work hand in hand and have that first book for nurses and midwives, by nurses and midwives. So yeah, I think for me, I resort to the education because the other projects I'm thinking about are either very specific to like radon or, the whole consensus on steering away from fossil fuel burning, which there's a lot of co-led campaigns with CAPE, our physician colleagues. Um, but yeah, if there's something from the education that would be, I think, phenomenal. And oh, the other idea I had is actually a conference or an event that is like organized by nurses for nurses in the space, but with the theme only on planetary health. I feel like it's being done in pockets, and sometimes like the locations are harder to access for some people, and so
I
yeah,
agree.
I
I
think yeah.
agree. And would something like that in your vision might be virtual or hybrid?
I think hybrid is like probably the best because maybe, one way that could be addressing making sure that there's equity at the center of planning is even encouraging local chapters, if you will, in different states or provinces to host their own events. So I know for last year, the first national day for planetary health action, which is one of the days when we actually planted trees at Providence, um, that was a movement and a call across Canada for people to host their own events. And
Hmm.
I think that was really successful as a campaign, but that was not targeting just nurses. Like it was, I think I just would like to see nurses take the step up more and not, I don't want to feel like I'm in a competition with medicine because it's not about competing, but I do feel like we're always a bit behind.
I absolutely hear you. Even in, I had the privilege of being able to attend COP, and I do see CAPE there. And I know that they do have the funding and the resources to be able to participate in COP. And I always think I would love to see Kane represented there as well.
Yeah.
I think that there are so many points of intersection. I love your idea about having some sort of virtual or hybrid type of event that really removes the barriers to nobody needs to look for a visa. Nobody, just something that is at a time that is doable for everybody would be absolutely wonderful, especially at this particular moment in time in history. The the intersection of nursing science and planetary health, um, to I think we can all agree is critically important to be out there and really be vocal about. Um, can I just in within that bucket of planetary health, within that, a lot of what Annie is looking at, um, what we're being made to look at are issues that honestly, I mean, I'm an old bird, so maybe this is shocking for me, but things like data centers and the impact on biodiversity or possible impact of biodiversity and air pollution and things like that. Is that an issue that Canadian nurses are grappling with as well? Because there are direct impacts on the ecology, on the water, on the air quality. Is there anything you can talk to us about that?
It's interesting you asked this because I found in the last 6 months of my role, it started being a question that kept coming up in our green team monthly meetings.
Yes,
And
yes.
I will say, like, I always started from a place of saying, this is an area that I recognize that I feel I personally need to build more capacity for myself. So I started doing some reading in my spare time. And I think there's a lot of both myths that have to be kind of like demystified and like talked about more so that people can understand, yes, there's pros, but we really need to understand what are the cons and what are the implications and how could we use our roles through that health first approach, um, to take on the conversations with people who are on the fence or who they're the non-believers, because I think that rather than going into it with an argument, it's better if you go with the business case of health as the first priority. I feel like it's not a conversation as I haven't been in a room where nurses talk about a lot about just the, AI or just generally just data centers. I think the focus is so heavily placed on acute care and trying to grapple with what are some mitigation activities that we can focus on. And I would say that's where I always try to counter that with saying that, we have more than just mitigation to worry about, like emergency planning and preparedness, adaptation. And so I think the conversation is only emerging with respect to data centers and AI. And I think that it is an area where we have an opportunity to shape our own understanding for our own profession, at least, and try to understand like what is the scope within which we could essentially try to engage in some action. But I feel like it's not predominantly talked about. Yeah. So,
Yeah, it's sort of like
yeah.
a topic that is extremely, extremely front of mind here in the US. And for those of us that are, come from that planetary health framework, melding AI and technology into that planetary health framework in a way that is um, health forward and public health positive, um, is something we're very quickly having to work on.
Yeah.
And it's absolutely exploding. And there other areas that others can think about? You mentioned a couple of times the tree planting.
Mhm.
in Canada. And so I know that that is something that US nurses are, passionate about as well. What would something like that, if we were looking at a magic paintbrush and a sort of campaign, um, would something like that be possible? Or maybe not. Maybe, I hate to think that our borders separate us, but I really feel like nurses, um, we can come together across borders in ways that governance otherwise wouldn't allow us to physically be together, but our ability to educate and come together on these topics transcends borders.
Oh yeah. No, definitely. I think first it starts with I mean, I think the campaign on the side like that's driven by nurses and other healthcare providers is very effective, but I think most importantly is, looking back to the organization and identifying if the organization has already, has a priority of addressing environmental aspects and issues and embedding that within their core their core existence, their objectives, their strategic directions. Um, I think it starts there. It has to, and it is a hard, it's not an easy road to to hop on. But I think that if, for instance, organizationally, you have a group of people who are coming together, who are passionate and are becoming that green team, right? Because we know that green teams really do make a difference as it's very upstream. It does put pressure on organizations. And honestly, like if you will do a comparison and say, hey, look, organization X in state, just our neighboring state has already done this many things. Like we need to take a stand. I think when there's that push collectively from multiple people,
Mhm.
um, it does put them kind of a little bit on edge because they do feel the need to kind of take action. And I've seen that happen locally with some organizations who are last to sign on to these initiatives, and who then, once they signed on, they have this crazy appetite to catch up with everything that's being done. So definitely don't ever fear that, this pressure that comes from movement building, that starts with a small group of people, can really have an impact. And that speaks a lot to what you're saying, that, I don't think that this idea that geographically we're separated by a border, but ultimately, like, we all have that's the same shared sense of purpose of why we're wanting to engage in this work. And I think that the other thing that I would really love to see more kind of tapped into is this patient as partner opportunity that we have. As nurses, we spend so much time with patients, whether it's acute care or community care. I think we have a really privileged sort of position because of that sort of very close relationship that we develop with each patient. And I think if we capitalized on that through the work, and if we showcase that, for our patients, the children, any sort of age groups, these topics matter. When you make it about, patients as partner, I do think that can help shape the narrative, because organizations are there to give care, and if patients are asking for it, then that puts additional pressure. So I think my call to action is that I think it's okay to create a bit of like disruption, like I said earlier, in the status quo, to identify like where the opportunities lie and where you can pair up with patients to drive some of these initiatives. And so, for instance, one of the for Trees for Health campaign that we did, it really started with actually a nurse. You probably know her, Aggie Black. Like, she is phenomenal. She's retired now, but she's actually still working. I feel like you retire, but you never really do retire. But she's got more time for this work now. And so she identified it could be a great opportunity to collaborate with a foundation, and which essentially helped match the fundraising aspect. And so it was also a campaign to help healthcare providers and staff and even families to say, if you want to honor a nurse or you want to honor someone within the organization, you can donate as much or as little as you can. And then that plants the trees for them. And then the other organization essentially matched their donations, and that helped us plant 50 trees within, I think we had a full year. And at these planting events, the two that I participated in were both within long-term care residences, and we had the patients come out with physiotherapists, rehab therapists, and actually literally like put soil in and really partake in that. And so I think, and then we had patients actually speak to why they like the idea of having trees because green spaces bring them peace. And so it's hard not to want to engage in this when you have so much like support from it for it from different staff and most importantly the patients.
I love that. And there's so much science-based evidence around green spaces and health outcomes that are data-driven, like, blood results that show an increase in natural killer cells in forest bathing. And so there's hard science behind it. And so I'm in total agreement, really seeing nurses as driving mechanism and moving that forward in terms of planting trees is it's it sounds like a quiet thing that's actually absolutely transformative.
Yeah.
So thank you so much for that. I see that one of our attendees, Grace Kistner, just wrote, thankful that data centers were mentioned recently in my critical care conference. Not as much as AI in general, but at least not siloed in environmental spaces. Thank you for that. Thank you for that comment. Um, Raluca, it has been such a pleasure to see you and to hear about your work. You mentioned being part of a book. Was that the recent Annie book launch, or was this an additional? Or
Uh,
are you able to drop that in the chat, or if not, send me an email? I'd love to share that.
It's so the book is not published yet. I think it's not, the other one is separate. And I feel like I actually had the opportunity to contribute to the one that Annie just published, which I honestly commend for. Like, I think it's fantastic. And I've been talking about it to other groups, like, make sure you go and get this book. But no, this is a global book. It's still in like editing. Like, it's not, I think the idea is to have it launched or published next year. I have to look through my drive and like I can send you more information about it.
Absolutely.
Because I don't know, like I think the call got initiated from Jack or Jacqueline Avanti Struss from Kane. And then, but like there were a lot of different people involved, like people at the international level. And so I think I personally just contributed to one chapter. But it's like different tiers, but it's supposedly one of the first books on. That's why, like when Annie also came with this one, and also there's the other work that was previously done by Annie. I try to understand like how are we when we're developing resources. I know that there's a lot of resources sometimes done in duplication. And I think sometimes it's really questioning, like, how are we making sure that what we're adding is not, you know, replicating something, rather changing or making something that's more transformational or something that's adding that's new. So yeah, I think that's always the hardest part is keeping up with everything that's transpiring from this space is overwhelming.
Absolutely, absolutely. And to your point, it is important not to just put out product after product that's already just a revision of something that was already put out previously. And I think that these days we can have original collaborative types of engagement that come out with creative, innovative, new um pathways in nursing, and that can absolutely happen and happens best in those collaborative spaces. So I'm looking forward to hearing more about the work that you'll be doing in the future. I hope that we can call on you in a year when the book is published to talk about your chapter again. And please send me any of the info. Are we allowed to share your slides? Would that be okay?
Oh yeah, yeah. Sorry. And
If
I,
you
I
can.
meant to, I'm gonna share my email as well if there's anyone who I'm also on LinkedIn, but if there's anyone who wants to connect separately, I'm available by email. And yeah, I think it's nice. It's I'm definitely in a different phase right now, professionally. I'm at a transition point right now. So I think it's trying to identify what's next. And I was saying to Millie before the presentation started that I am trying to step into the self-employed world. Oftentimes, I think the most difficult part with sustainability jobs is that a lot of them are contract based. They're very short term. They don't always come up with like permanency. Some people have more luck than others, but I think that means it's also that, how do we develop that inner resilience to figure out like, okay, how can I use what I know and my skill set and be of use in other ways? And I think that's why I'm kind of in the space of reflection and trying to see if I can do this on my own as a self-employed person, but in a way that adds value and not doesn't just replicate something that someone has already done. Just always looking to add value to my community and both locally and globally as well. That's really ultimately why I keep doing this work because it's really important. And yeah, it's almost like not work because it's if it's part of your purpose, it shouldn't feel like work.
Well, it's certainly your passion for this absolutely radiates, and it comes across in a way that makes the audience want more. They like we want to hear more from you about this. So, many appreciations. Please send me the slides. I know that our members, being that this has been recorded, it'll be shared out with members who couldn't make it at the time, but will most certainly get great value from listening at the replay. And if I'm able to share the slides, even better. So
Of
once
course.
again, Raluca has put her email in the chat. I don't know if you want to drop in your maybe your LinkedIn profile.
Yes,
Um,
I can do that. I think that's the one social media outlet that I am maybe over using too much. My spouse always says like, I've never seen anyone addicted to like professional social media. It's not just that. It's just I think I'm having some issues. I'll send it along
okay,
with my
that's
slides.
fine.
I'll embed my contact and I don't know why it's having issues, but
Yeah,
I
yeah,
think honestly, LinkedIn, I would say during the pandemic, especially when I was
yes.
also so new in the space of climate change, it really forced me to get to become more extroverted and to connect with people across the world. And I feel like that's also kind of how the two of us met, like in the space of this. Like it was just
During the pandemic,
so
yes.
it's just trying to use it with good purpose. And I think, yeah, I just wanted to say one closing remark is that I think if as nurses, what my hope would be is if there's a way for us to work collectively on building the business case for nurse, clinician, scientists who sit across academia and acute and also primary community care and work in roles of environmental sustainability across both, like not just in academia or acute public health. I think that would be the ideal role. Just sharing this based on my experience having wrapped up this role as planetary health lead, it's been a wake up call to realize that, nurses are definitely very versatile. And I think if we had more of those kind of positions represented by nurses, um, it could help kind of stir more of generate more of that sort of movement towards engaging in this action and essentially helping the organization see that nurses should have protected time and respite from their usual activities and expand its scope. Essentially, it's really a call to expand the scope to include leadership in that way as well. So if you have the power in your positions wherever you are, like I think if you can advocate for that, I think that's kind of like my wish list for if I had a magic wand,
Well,
that would be it.
I know that in the NIH, I don't know if they had a pilot study a couple of years ago. I don't know if it's continued to be funded, but within NIH hospitals, yeah, in the UK, they were able to fund a certain amount of bedside nurses, clinical site nurses, to have split their hours between patient care and then working towards sustainability objectives. And this was to me, an incredible idea that they would be funded to actually
Yeah.
have that nursing role, look at green spaces within the hospital, and looking at waste management from that public health perspective, and really calling for the nurses to be at the table in a
Yes.
in a forum with other stakeholders from the hospital where they could contribute to this. And I had never heard of such a thing. So thank you for planting these seeds, because indeed, when you open these conversations, that's exactly what you're doing. You're planting seeds of creativity and reimagining what could be in
Yeah.
nursing. So thank you, thank you, thank you, thank you. And with that, does anyone have any other closing remarks? Otherwise, I will gift you 8 minutes back of your time. And I did drop your LinkedIn profile in there, and
Right.
I'll reshare that to the group.
Perfect. And I just sent a link to a publication that talks about like mobilizing nurses for planetary health. So
Oh,
yeah,
lovely.
I'll share all of this with you, and then you can pass it on to folks who couldn't
Wonderful.
make it.
Yeah, wonderful. All right, my friend. I will see you on LinkedIn, where we both
Yes.
hang out lots and lots.
Thank you so much, everyone, for taking time in your evening to join in.
Take care, everyone. Have a good long weekend.
Bye.
Bye-bye.